My name is Terry Nesbold. I'm the state's attorney for Brookings County. I have been since January of 2018, and it is my job to protect the citizens of the county and also to dispense justice as much as I can, but my real passion is drug court. I would say almost every single one of my property crimes are related to drugs. People are burglarizing to get money for drugs. People are committing aggravated assaults, simple assaults due to alcohol and drugs. So it's so cyclical, but when people aren't aware of just how much methamphetamine is in this community, and now we're seeing a lot of opiates. We're seeing a lot of heroin is coming in the communities. We're seeing fentanyl coming into the communities. And so, you know, Brookings County is a very safe county, and so people aren't maybe aware of it. It's so prevalent, and it's people are addicts that you just don't even know because they're hiding it. They're functioning addicts, but every crime seems to stem from that epidemic. Almost all my burglaries are to do with that. Kidnappings, drug related. Everything is tied into the drug epidemic. Drug court is a treatment-based sentence that is handed down by the court for people that are convicted of a felony drug offense. They cannot be someone with distribution charges, but anybody that has a controlled substance charge can be sentenced, if approved by the drug court team, to drug court. And it is intensive court supervised therapy from a minimum of 15 to 24 months. It really depends on the individual. There's phases. There is, as I mentioned, intense probation where they have to check in and really be detail oriented. It isn't something where you just check in once a week. You are on the clock with this program, and that's one of the reasons it's successful, is because it is so intensive, and it is made to change the person holistically, not just to get them to stop using drugs, but to get them on the right track financially, job security, get them a place to live, change the person. And it is a wonderful program, and it's been very successful here in Brookings County. Drug court can be very successful with treating drug addiction, but the main focus and thrust is that the person has to be willing to do it. And we can only be as successful as the participant. And our mantra is, show up, try, be honest. You've got to do those three things, and if you do that, you'll be successful. But it's the changing of their whole lifestyle. Some of our participants have been drug addicts for 30 years. Some are younger and have just started their drug addiction, but they're at their lowest point in their addiction when they come into the team. And we expect relapses because you don't just change overnight, but it's the fact that they own up to it, they're honest, and they use our treatment for their benefit. We have wonderful treatment providers that are on our drug court team, and we're there for them. We are so involved in the community with AA and and it's just a whole cycle that these individuals have to change, not just stop using drugs. They have to decide that they want to change every facet of their lives. And when they do that, and when they work hard, they'll be successful. Some of the other resources that are available in Brookings County is, as you know, Avera has really stepped up with their treatment programs, and Sanford has. We've got East Central Behavioral Health that works on it. But the unsung hero that I think is very just knocking it out of the park for us is our AA and NA communities. Although they don't provide treatment per se, they're a place where people can get some sort of family vibe, that they're not alone. And that's the thing, with a lot of drug addicts, there is just so much self-esteem. They're just not feeling fulfilled in the community. And with the Alcoholics Anonymous and Narcotics Anonymous, they have a group of individuals who are there to support them. So outside the drug court team, where we give them all the support we can, they have another facet where they can go and get that support, and they can go to 2 or 3 classes a day if they want to. We have some participants that go to multiple classes a day, and that really helps solidify their treatment. And Lutheran Social Services is a member of our drug court team. I believe there's a new place that's just starting, Brookings Counseling Services There's just a lot of places to go, but we're limited with the amount of people that can help because it's a bigger problem than what people realize.